Hi, I'm Dr. Christian Jordal. I'm the chair of the Department of Counseling and Family Therapy. I've been at Drexel for 11 years. I'm an associate clinical professor, and I also am the program director for the Master of Family Therapy program and the interim program director for the Human Development Counseling program. The Human Development Counseling Plan of Study is a campus-based program, a 4-year degree, and there are two options. You can do a 4-year degree with no co-op experience, or you can do a 4-year degree with a co-op experience, which we recommend. Specifically, it is a very unique applied course of courses in this program in which you're learning basically skills that will lead you into a career in healthcare. When you think about that, our students take courses in treatment planning, in group therapy, in behavioral healthcare careers, in introduction to dance therapy, to music therapy, to family therapy. They take human development courses such as human sexuality, and also they take sort of very specialized courses. For example, this term we're running a course in therapeutic gaming, and we will be running courses in the future as well in poetry therapy. And so students who come into this program are interested in healthcare. They're interested in helping others. They are not sure necessarily what that is for them, but they also want something that's a little more applied and less theoretical. And so that's what this program is designed to do. With this degree, you can get an entry-level job in a community-based organization, in a healthcare setting, as an intake coordinator, as a peer navigator, generally a position that is non-clinical. You're not providing any type of therapeutic services, but a position in which you are facilitating the process by which an individual, couple, family seeks mental health services. And specifically, you're holding a position that is more administrative, but is both vital to facilitate that process. And it also requires the individual to have an awareness of the process of sort of how a person connects with and receives services related to mental health. Many of our co-op students work in community-based organizations with specific populations of people or around specific issues. For example, we've had co-op students working in recovery-based organizations here in the city of Philadelphia and the surrounding region. We've had individuals who are working in hospital-based settings like Drexel Med, specifically as peer navigators. But specifically, you would be doing that for 2 quarters. Generally, that's in your junior year in the spring and summer. And specifically, you would be getting on-the-job experience that was an extension of the applied courses you took over the first 2.5 years in the program. The HDC program, you are taking courses that are more applied. They're based upon theory, but they're also about teaching students skills they need for the workforce. And we're constantly sort of trying to remember and think about what is it that our graduates are going on to do and how can we best prepare them for that. Courses in treatment planning, courses in case management, courses in sort of group therapy, as well as simulation is sort of an environment in which we as a program hire actors, and then we train actors in healthcare scenarios. And then we have students as part of their coursework and part of assignments, we run them through different sort of summative, informative type evaluations. The students go on to seek graduate level degrees in different mental health disciplines, marriage and family therapy, the creative arts therapies. And so specifically, we have coursework that introduces them to those disciplines. I think that you should choose Drexel if you are looking for an urban-based experience, if you are looking for a college and a department and degrees that are specifically thinking about workforce development. They're thinking about our students' future alumni and jobs and what they want to be doing. I think that if you're interested in community engagement, if you're interested in sort of interprofessional sort of activity, because Drexel is one of the few universities in the US that offers the co-op as an opportunity to really learn on the job. And that's part of the, curricular experience, part of your plan of study. I also think that we are small but mighty, meaning that I think that if you talk to students and alumni who've been here, they have a great deal of loyalty and really value specifically what it is that we have to offer. And they come back. Many of our graduates of our undergraduate degrees come back and go on to advanced master's and even PhD degrees with us. Historically, mental health was seen as something that we're supposed to put away and not talk about, and something as separate from our overall well-being or overall health. And I think that especially our students and young people see that. They understand that mental and physical both are a part of that idea of wellness. And I would also say it extends to community, whether it be the school, whether it be the community physically at large, whether it be our larger society. And so I think that when I think about this particular program, Human Development Counseling, it's the foundation. So our students graduate, they go on to entry-level positions in healthcare settings, working as peer navigators, working specifically as sort of intake coordinators. But in addition to that, many of them go on to careers where they basically want to pursue additional master's or even doctoral level work. They can become both clinicians, providing clinical services, and that gets into teaching, doing research. How is it that we specifically push and expand sort of the idea of and the importance of mental health as a component of overall wellness, individual and collective. What I want to tell parents is specifically, if you have a child who is interested in helping others, as I respect you know, there are many ways to do that. I think that ultimately for our program, I think if your child is not clear on what they want to do, and if also you believe or you notice they're very empathic, they're a good listener, they're very connected to you and to others, those are some natural skill sets that lead students into our program.